Hi, everyone. Today we are going to be talking a little bit about how why capitalism as a category reproduces certain violent conditions, and why neoliberalism itself, um, why neoliberalism itself is an extension of racial capitalism. And so I guess going back a little bit to what we were talking about before in terms of how to utilize racial capitalism on against the in the context of the resolution. We were obviously talking about medicines in the context of public health, and so thinking about how medicines and the protection law exist, those things are caught up in a sort of a pre-existing fixation on racial capitalism, right? And so we want to be thinking about ways that the affirmative can sort of approach responding to the resolution. And one of those ways is thinking about Cedric Robinson and thinking about abolition democracy, right? And so if we want to think about how different ways we can sort of approach the way that the World Trade Organization attempts to alleviate certain protection laws, because it believes that it has the best way to tackle COVID-19. And obviously, this becomes a discussion sort of about the sort of underground ways to sustain Black life, to sustain other forms of social life, right? And so obviously before that, we have to think about COVID-19 sort of past a little bit of racial capitalism, because obviously racial capitalism is primarily about how state and capitalism deem certain bodies unworthy. But there's also, if you want to think about this in the context of anti-Blackness, obviously you can connect the liberal economy to COVID-19 by saying that anti-Blackness, it's rooted in slavery, right? It involves the desire of the dispossession of certain Black bodies, right? And so thinking about how the sort of limit of the spread of virus works in tandem with the logics of sort of violence that racial capitalism depends upon, obviously, because it produced certain deemed legitimate populations. Then obviously it allows us to sort of think about how the world, the WTO, all of those things exist as sort of extensions of the prison industrial complex, right? And so thinking about how we can't separate those things is how some bodies are sort of naturally disposed to risk itself, right? And so that risk is sort of where we're going to get at when we're able to talk about the way that protection law is obviously mediated also by some forms of risk, right? And so thinking about why capitalism basically reacts to the disposition of the lack of medicine with such intense risk. It's under that guise that elitism allows itself to sort of come out and exist. And that's why we get to that's why we see the logic of racial capitalism sort of being preserved, right? And so if we want to really take the debate to the impact level, we really want to think about how there's a sort of spatially and temporally there's violence. There's the race war, right? There's constant violence against Black bodies, right? There's but we see people who are taking down people who are looting, who are rioting. They throw away mutual aid supplies all the time. There's all of these things that colonized bodies do in order to resist the sort of contradictions that the state imposes on itself. And that's kind of where you want to be thinking about in terms of abolition, right? Be thinking about the ways that certain people care about each other, are providing those medical practices. There are people who do abolition studies, who are doctors, who are people who administer the vaccine. And so it's mainly a question of how do you sort of in mass sort of of allow, an uprising, a resistance through, based upon resisting the sort of violent services and the violent orders that attempt to, produce, an effective, mediation of risk in the hope to, quell certain populations, right? And that's kind of how, the resolution will attempt to, use the protection law in order to make a monopoly on the sort of technology that's used in order to, regulate public health, right, and regulate those medicines. And so you can never really believe that the end result of the nation state attempting to mediate medicine or public health will result in anything less than a more racial injustice against Black and brown people, right? It's not purely just economic, it's also libidinal, it's also social, right? And so it's also structural. And so you want to be really thinking about how the discourse of the law, of protection law, of intellectual property protection law extends itself to the self, right? And so it's not purely about the way that labor and the capitalism sort of exists through technology by itself, but we can understand how neoliberalism's investment in public health exacerbates racial difference, and that's kind of the sort of argument you want to kind of be thinking about, and thinking about how that produces a sort of sacrificial logic, right? It produces a logic that, bases freedom from, the sort of trope of disease as freedom itself. And so that makes, freedom from disease a sort of white, malleable economy that works, to designate certain bodies as enemy and diseased, and therefore made, available and justifiable to expend. Thank you.